Welcome to an expanded local edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about setting up an earthquake early warning alert system in the state of California. My guest is Jerry Hill, a member of the State Senate from San Mateo. Thanks for being with us.
My pleasure, Steve. Happy to be here.
So I guess let's back up. For a couple of years now, we've had on the books a law in California that really sets up the framework for an early warning system, an alert system.
Yes.
But it's that legislation was flawed to some degree.
Well, no, the legislation, and Senator Alex Padilla authored that, and the challenge was to get it out of the legislature without costing money.
Okay.
And so there had to be an amendment, and it removed any funding source from the earthquake early warning system, and it required a public-private partnership, but mainly the private part of that. And so for the last 2 years, we've been struggling trying to move the process along to try and establish the system. It is operational at this point in time. There are about 600 sensors around California in different locations. We need about 1,000 total to make it work completely and to integrate those and to communicate with one another so that when that earthquake does occur in one part of California, those P waves, which are the waves that come before, kind of like lightning and then the thunder. The lightning is the P wave that travels underground, and it notifies people and allows them to get the signal that an earthquake's coming before it actually hits. And you can get 30 seconds to a minute, possibly, of warning.
Which would be tremendous, of course.
Tremendous. It would really be tremendous.
But this public-private partnership just didn't gel.
It did not gel, and I think the reason is that the private part looked at the public part and said, you're not really contributing your share, you're not really invested in this, and you should be a little more. And I think that now that we have an opportunity to get about $23 million is what we're asking for in the budget to implement a one-time funding that we could then establish this system, provide those 400 more sensors around the state, and have a very accurate early warning system that will make a big difference.
Assuming you get the money to set this thing up and get it going, who and what would get the alerts? How would that work?
Well, the idea is that, I mean, just to think, initially, if you have a fire station, if an earthquake's coming and you get 20 seconds of warning, the doors will come up automatically so that the fire engines will be able to get out without having the doors and be stuck inside. The BART trains or trains around California would stop before it goes. Elevators would stop at a floor and the doors would open, so you don't have to worry. But more importantly to me is that optometrist who is an ophthalmologist. It's got the laser in someone's eye, can pull it out before the thing starts shaking. So, and then you look at the commercial applications where you have factories, where I represent Tesla's headquarters. They have robotics. They want to stop this equipment. So around California, there are a lot of needs to stop the equipment so that you don't have a problem of having it malfunction or harm someone.
Or get stuck in an elevator.
Stuck in an elevator would help too. And so it has utilities would use it because they want to be able to adjust their power consumption and move it around too. So many uses.
Would this be a one-time spending of $23 million or ongoing?
Well, we're looking for one time.
Because that's an issue in terms of trying to get Governor Brown to sign it.
It is. That's absolutely true. The governor does not like on-time. We're looking for one-time funding, and then we can look for the ongoing expenditure. There is partial partnership with the federal government coming in and other funds, and I think we can get the private part. But one of the other things I wanted to point out how important this is if you have this notification on your phone so that when that earthquake is coming imminently and you have a 20-second warning, it will tell you have 20 seconds to duck and cover. 50% of all the cost of an earthquake is related to the personal damages and injuries that people get from falling debris. It'll give you 20 seconds to get under the table.
And the technology is there now.
Technology is there. It's getting the telecommunication companies to work to try to put it together to make it work for all of us. So it's getting there. It'll be there in a couple of years if we can get that money.
Well, that's fascinating, and that would be tremendous. I want to segue to another issue because we do have an expanded interview program here. One is a piece of legislation that you have now that I don't think has been heard by any committee yet regarding interlock ignition devices for those convicted of a DUI.
Yes, this is legislation that would require, if you are convicted of a DUI, that you would be required to have an ignition interlock device installed on your vehicle. Then that device would not allow your vehicle to start. Every time when you get into it, you have to blow into this device. Right. And if you have alcohol over a certain level, it will not start the car. And
I was going to say, there's a pilot program underway right now,
Four
right?
counties have
Los
that
Angeles,
right now.
including
Los Angeles, Alameda County, a number of counties have that right now. In fact, over the last 4 years in that pilot program, Mothers Against Drunk Driving have just conducted a study. Over that 4-year period, over 1 million times that has stopped someone from getting behind in that vehicle, starting and moving on because alcohol was detected on
in
their
just those 4 counties?
4 counties, 1 million times in California. It has prevented someone from going.
So your legislation would take away the pilot program and make it statewide?
It would make a pilot program statewide. It would become a statewide program, and the reason that a number of states have done this throughout the country, and if you look at some nearby, Arizona, New Mexico, they're showing a reduction of 30 to 40% of deaths due to DUIs in those states. So I think it's something that's time has come, and we shouldn't tolerate especially that second and that third DUI that we see sometimes.
That's interesting. I want to segue again to another piece of legislation you have, which is really getting a lot of news coverage statewide, and it deals with requiring doctors who have been placed on probation for disciplinary issues, whether it's sexual abuse or whatever, drugs, substance abuse, requiring them to notify their patients that they are on probation. And that's obviously very controversial with the doctors' lobby and with the California Medical Board.
Yes, well, the California Medical Board or the Medical Board of California is the body that oversees the licensing regulations of physicians. And they made the decision last November that they were not going to move forward with a notification of patients of those physicians. And there are only about 500 or 600 who are on probation for some type of serious offense.
Less than 1%.
Less than 1% of the 100 and some thousands, 170,000 physicians that we have. So it's a small percentage, but some of them have been accused of and been found guilty of some very serious offenses. In one case in Orange County, a physician was found to have actually killed a couple of patients because of overprescribing and knowing of narcotics. And that physician was given 5 years probation. During that probation, the patients would go to that physician. They would have no way of knowing of the history or what was going on. They can find out today. The medical board has on their website, but you have to navigate their website and look for it.
Plus, we have still have a digital divide where a lot of people don't have computers and access to the internet.
Very true. And you usually don't think of doing that when you go to your doctor.
Right.
And so what this does, and the interesting part is right now, if you are on probation as a physician, you have to notify your hospital, the hospital that you're affiliated with. You tell them that. You tell your malpractice insurance company that you're on probation, but to me,
it doesn't trickle down to the patient.
Doesn't trickle down to the most important part of that equation is the physician, is the patient, and the patient should have that knowledge so that they can make a wise choice as a consumer. And I chair the Business and Professions Committee in the Senate, and our purpose is the Department of Consumer Affairs, and patient protection is a very crucial part of that.
Now, this bill hasn't yet to be heard.
Has not been heard. Just was introduced last week, and we're looking forward to moving it. And actually, we're just trying to see there may be possibilities of including other health professions in this as well. Perhaps the chiropractic board, naturopath, osteopath is in all of them.
But the California Medical Association, you have to assume, is going to find some problems with this.
I think that they will probably find some problems with it.
They've often said it interferes with the doctor-patient relationship and the dynamics there.
It does, but I think when you have a physician who has been found guilty of a very serious, and this only applies to very serious offenses, you need to take some action, and I think this is necessary.
All right. Senator Jerry Hill, thank you very much for coming by and talking about these important issues.
Thank you, Steve.
We enjoyed the interview.